Good evening, folks. Tonight, it is Wednesday, Humpday Happy Hour. I don't know about you all, but I am having a fantastic week, and I am super excited to be here with Dr. Jennifer Bell from Dentist in the Know. I'm going to bring her up in just a second, but she told me to show you a little bit of excitement, so I'm going to show you a little bit of excitement. So tonight, we have a great guest who actually does a lot of amazing things for the community, for the dental world, Dr. Jacob Dent, and we will introduce him in just a few minutes. But for those of you that either do or don't know us, we are Dentist in the Know. We are your backstage pass to all the trends, politics, and issues within dentistry. It's live. It's over a cocktail, which I don't have. I'm going to have to go get one while Jennifer's doing the news, but it is live. It is over a cocktail, and we try to provide you with the latest of what's going on in dentistry, to keep you in the loop, to keep you informed, and it's unbiased and it's educationally focused. And I know that's not what Jeff says, but damn it, that's what I say. So thank you all for being here tonight, or whenever you listen to this in the future. But without further ado, I'd like to introduce you to my co-host for the evening, Dr. Jennifer Bell. Dr. Jeff Horowitz is not with us tonight. How the heck are you, JB?
I'm good. I just departed the crazy train from outside of my practice just a few hours ago, so I'm feeling much better now. Do you ever have those days where you feel like literally a bus for just the very strange in your community just roll up all at one time? It's almost as if it's a coordinated event where they show up to yell at you, make really wild demands and things, and it's all simultaneously. So you're just going from one operatory to the next going, can I just get a class 2? Like, I hate class 2s, but right now I will pay you if I could just do a class 2 and we don't have to.
It's really funny because
Is it the moon?
I happen to say that a lot. Like, what bus or what boat pulled up in our parking lot and dropped all of these people off on the same day? But today I almost did a post in Dentist in the Know, and you know, sometimes I think of saying things and I realize it's probably not the best thing to say, but one of the things that I was going to ask today, and obviously I didn't, so I can ask it right now, is that do you ever have a patient on the schedule at like 3 or 4 or 2, 1, whatever, where the whole day you're like, oh my gosh, no, not today. Any day but today, not today. Yeah. Yep. I think we all go through the same thing.
Case. Like, it doesn't even have to be patient specific, but maybe it's a case that hasn't gone quite the way you would write the book. You know, if you were the master of your own destiny and everything you touched were perfect, that particular case just hasn't quite gone quite to the execution level that you would prefer. And you sit there and you watch it all day long. You see it. Patient reports pain after your crown, you know, like, and you see that little blurb, and it seems the admin team, it's created such an innocent little comment, right? Just so you know, but yet it's literally eating me up all day going, oh my gosh, are they going to come in mad? Is this a big issue? Of course, they were asymptomatic before I started. Now they're symptomatic. Like, yeah.
Well, you know what though? The further you go through your career, the less that bothers you, because, you know, my business partner's favorite phrase is that, you know, we're called doctors of dental surgery for a reason, right? Because we basically perform a surgical procedure every single day. So after surgery, you should expect pain. Obviously, we don't want people to be in pain, but, you know, it happens. Sure. Sometimes things aren't going to go our way because we're dealing with the body, and, you know, it happens again. And, you know, you just got to get to a point where you brush it off. But there's some people that just don't really let you brush it off. You know what I'm saying? It's like, no matter what you say, it's like, nope, that's not the case. Nope, that's not the case. Nope, that's not the case. You know? So I get it.
It's all your fault.
It's all your fault. Yep.
Yeah.
So,
well, you know, it's like a golf game, and you should understand this better than any. It's that one great shot. It's that one great crown, that one great cosmetic case, that one appreciative patient that you either solved a problem, accommodated so beautifully in your practice, like you made it feel so comfortable. They were anxious, nervous, they had special requests, like you did it all right, that convinces you to go back again tomorrow and do it again, because you're like, if they were all like this profession would be pretty easy to do. Hey,
I
can I ask
totally
you a
agree.
question?
Ask away.
How's the hiring situation in Texas? Like, so we're 4 years post COVID, but then we've had this whole kind of reset, and we really haven't talked about this lately, but I'm curious if you had an opening today, maybe you have an opening, but if you were looking for a hygienist, admin, or dental assistant member, or even maybe a new associate doc to come in, what's that looking like for you right now?
You know, fortunately, I don't know. I
That's
really
good. So
don't.
you have no openings.
No, I mean, we don't. We had a couple last year and 3 months ago, and it was tough. I don't know that it's much different. And honestly, in our local banter, I haven't heard much about it. But one thing that I will say is people aren't complaining as much about the shortage nor the salaries. That's all I can say.
Okay.
Yeah.
I can't really say the same. So I guess
Yeah.
so. Like we posted a hygiene position a week ago and have had no qualified candidates. None.
I know Jeff went through that too. And fortunately, we just
Yeah.
haven't been in that boat. So we've been pretty blessed over the past, 15 months. We actually had to hire 2 hygienists at the same time a year and a half ago, roughly. And that was a nightmare, but it all
Mm,
worked out in our favor.
yeah.
Um, but yeah, we haven't been in that position. Praise Jesus. So
Yeah. Well, now that you've spoken into existence, 3 are quitting tomorrow. So good luck with that. I really appreciate it. I know. Exactly.
yeah, yeah.
Exactly.
So
Well, I'm
anyhow,
glad for you. The rest of us will just be out here suffering in silence. It's fine.
no, I agree, and I'm sorry that that's all going on. But
That's
yeah.
okay. I've already sent um, solicitation letters to your team.
Oh,
And
well,
threw
good.
up in a relocation bonus as well,
Well,
in case
I
they
can
wanted.
guarantee you that Tracy will probably go to North Carolina
Oh, yeah,
because
her family's
anything
here.
to
I'm
get
just
her
gonna
back.
go ahead
Yeah,
and bring her.
yeah,
Yeah,
I don't know if
fine.
she'd leave her husband, but she might go to North Carolina.
Well,
So
he can come.
yeah, yeah, yeah. You never know.
We accommodate married couples here. He can come.
Yeah. Sorry, I have a noisy dog in here. That's the problem with live TV, right?
I wish you would stop saying that about your wife. It's so inappropriate on a live show.
You wish I'd stop saying what?
Saying that about your wife. It's really inappropriate.
Oh, geez, oh, Pete, that's horrible. Ellen, she just called you a dog.
No, I didn't. I didn't.
So,
Nope.
anyhow, hey, do you have some news?
Always.
All right, I actually have a news story too that I'll share with you after you're done, but I'll let you go ahead.
Oh, I can't wait. Oh, I'm
All
sure
right.
it'll be riveting. That's
And
why you
before
have
we
the
do,
segment and I don't.
I do just want to say that for those of you that don't know, tonight's episode is sponsored by AIDA, which is the American Independent Dental Alliance. We're very thankful for our partnership with them and for all that they do for education in dentistry. So thank you, AIDA. But I'm going to turn it over to JB to speak a little news to you.
Are you ready?
I'm ready.
Okay. Well, I mentioned that question to Chad about hiring issues because it's been a bit of a rambunctious week, I guess you could say, in the dental world. So we're coming off of SmileCon, we're coming off of the ADA's House of Delegates, and where they had a couple pretty big resolutions on the docket for workforce issues. And it has created quite a scuttlebutt in the dental community as these resolutions have had the light of day now for folks to review, particularly in the dental hygiene world. And so some of the resolutions were meant to address some of the issues that many of us, unlike Chad, are experiencing, particularly in the dental hygiene space, and identifying and finding candidates for dental hygiene in our practices. So they made a few modifications, passed a few resolutions to hopefully move forward the agenda to allow more folks to pursue the career of hygiene, even if temporarily. 3 total resolutions were passed to deal with this particular issue. The first was allowing internationally trained dentists a path to licensure just on the dental space, becoming licensed dentists here in the US. The second was letting active dental students and residents practice hygiene if they've fulfilled their competency requirements on the hygiene side. Then they can actually become a hygienist while also being in dental school. And then the third was increasing the number of faculty and student ratio. So modifying the faculty student ratio in our allied dental education programs to allow more students per faculty member. That's also actually to address the lack of ability for them to find qualified hygiene and dental assisting educators as well. So they're increasing the number of students that will be allowed per class in correlation with the number of faculty members there. No surprise that the support organizations, particularly the Dental Hygiene Association, American Dental Hygiene Association, has come out against the resolutions, wanting to work with the ADA to see if they can tweak this in some way that might be beneficial for both parties and for the patients involved. So we'll see how this moves over time, but they're going to have a bit of a challenge defending the fact that most dentists, in fact, the more recent data coming from the statistics that we're getting, the HPIs that we're getting from the ADA, is finding that 91.7% of those dentists that were surveyed indicated that they've been looking for hygienists and found it very challenging or extremely challenging. And currently, more than a third of our colleagues are currently looking to fill hygiene positions. So I think the ADA is kind of putting forward some resolutions for discussion to see if we can move the needle on those open positions and start getting these patients seen in a more efficient and timely manner. Another heads up for all of you who own small businesses, that would be most of us that are in the dental space. If you have less than 20 employees or have a gross annual revenue of less than $5 million, then you are required to start reporting the Corporate Transparency Act. That deadline is January 1 of 2025. You can go online, Google Corporate Transparency Act. It will take you to the site for you to fill out the information. It does take a bit of work. You have to register for an ID number and a few other requirements in order to fulfill this particular new law. There is continued pressure to extend that deadline, AKA, I think, try to get rid of this new act. But in the meantime, it is in place. And if you haven't fulfilled it yet, the deadline will be January 1 of 2025. I have to say the penalties are pretty hefty. Civil penalties would include fines up to $500 per day for non-filing. And then criminal penalties are also available or could be imposed as well at $10,000 for up to 2 years. So they're not laying on this lightly. If you haven't at least looked into it to make a plan for having this completed before the end of the year, I definitely would do so. You can seek help from your attorney or your CPA, but in full disclosure, it's a little time consuming, definitely annoying, but doesn't require a specialty degree to complete. A little consumer protection information coming out tonight for those who use Tom's of Maine. So the FDA has just officially placed a warning on the batch of Tom's of Maine toothpaste. This has been after years of trying to work with Tom's of Maine to address a known issue of having water-based bacteria in their toothpaste supply. They had identified several different bacteria that contribute to blood, lung, and urinary tract infections. 400 different complaints have been filed against Tom's of Maine from consumers about color, taste, and odor issues associated with these toothpastes. I think it has to do with the water lines coming in to the plant facilities, maybe even the municipal water supplies that they're using to clean the equipment that manufactures and packages the paste. They've had multiple warnings in 2021, 2022. This has led up to the spring of 2024, and the recent letter dated to them in November of 2024, where the FDA has now cited a pretty large restriction to this particular product. So what this will mean for Tom's of Maine, I have no idea. If you didn't know, it's now a subsidiary of Colgate-Palmolive. Many of us in the dental space have been familiar with Colgate for a very long time, but it does seem like the FDA is continuing to escalate their concerns with the manufacturing process for Tom's of Maine, and citing this bacteria infestation being a major issue. So we'll see how this translates. If you're a big fan of Tom's of Maine and you start to find the product is more difficult to locate in your grocery stores and online, this is likely a result of that particular issue. Two brands specifically that have been identified by name, and that is the White Clean Mint paste and the Wicked Cool anti-cavity paste marketed to kids. And with that, that's the news.
I'm going to try this real quick.
Okay, let's see you do it.
Why don't you sit back and watch this?
Okay.
Folks, today you might have noticed, if you live in Texas, that the Texas State Board of Dental Examiners did send out a notification to those dentists in Texas. Actually, what this notification is in reference to is a fraud alert. The notification is dated Wednesday, November 20th, 2024, and the Texas State Dental Board of Examiners would like to acknowledge that they did not indeed issue a mandate requiring all dental professionals to be vaccinated against COVID-19 by January 1st, 2025. If you did receive this notice, please disregard. If you have any information as to the origins or have received the fraudulent letter, please contact complaints@tsbde.texas.gov. Thank you. So, folks, apparently there is some fraudulent activity occurring in the state of Texas. And if you are a victim to that, please note that you do not have to be mandatorily vaccinated against COVID-19 by January 1st, 2025. And with that, that's the rest of the news.
First off, we're going to let Dr. Dent vote on who did the news the best, and we'll just see how that goes. The second thing I would like to say is, like, what a stupid scam. Like, where's the money? Where's the Nigerian princess? Where's the cash cow? Who's winning, coercing people to vaccinate?
Well, before we bring Dr.
Someone
Dent
selling
up,
it in a tent?
you want to talk about stupid scams, okay? In the past 3 weeks, and I haven't told you this, I've been scammed 3 times. 2 employees and myself, all calls at the office from the Tarrant County Sheriff's Department telling me first off that they knew so much about me. It was scary.
It's scary.
It was scary. And anyhow, I supposedly didn't show up for jury duty.
Jury duty. I knew it was jury duty or a speeding ticket and a warrant out for your arrest.
This guy had a Tarrant County Sheriff's Deputy's badge number and name that was legit. Scared the absolute crap out of me. I got the Tarrant County Sheriff's Department on the phone when he was calling, so that was annulled. But this is the worst one. On Sunday, I got a letter because we were out of town. I got it on Sunday that my son's taxes weren't filed in a timely manner, so he was being penalized. That was corrected by my accountant because we had all of the transcripts that everything was gone through.
Right.
Jokingly, I said, "What happens if mine come back?" Well, on Monday, I got a letter from the IRS that somebody has stolen my identity. They filed a claim with a refund earlier this year. I had to call the IRS, spent an hour on the phone with them on Monday night. They couldn't verify my identity online. So I have to show up to an office and meet with an investigator on December 20th, share my past 3 years of tax returns, share my identification, and meet with them to prove that I am me. And I can't apply for any loans or anything until all of this is cleared up, which could be up to 9 weeks after that meeting because I have no tax return on file. However,
did they get your refund?
I'm not getting a refund. I wrote a damn check, but guess what? That was cash, no problem.
Yeah.
That was cash, no problem.
Right.
But apparently somebody filed a refund under my name is what we're thinking. I don't know that to be factual, but I looked it up, and there's a lot of people, folks, that this is happening to. So Be careful. And my wife had this happen about 10 years ago, and we've had to file with a PIN every single year, so they don't understand how it happened to me. But I am not looking forward to that meeting. Anything with the IRS scares the crap out of me. So
Can you
it's
ask
not
the
fun.
IRS agent to also bring his 3 years of tax returns so you can verify that he's actually an IRS agent?
Yeah.
I'd like to see the
Well,
W-2.
I know the building. It is the IRS building that I'm going to. So
I'd still like to see some
anyhow,
credentials.
without further ado, should we bring our guest up?
I think that would be lovely.
Okay. So as we bring our guest up, I'm
Wait,
going
wait,
to
wait, wait.
introduce him. What I
When
do?
did you want him to vote? Now or later? Or
Let me introduce him first, please. Thank you. Okay. That's the first question you can ask. You can
okay,
ask him who did the news better, but I'm going to
yeah,
introduce
okay,
him first. Okay.
fine.
So I'm going to introduce Dr. Jacob Dent, who I barely know, but I'm going to tell you right now, this guy and I have a lot in common. All I should say is he's a Louisiana boy. But beyond that, he's been in practice for 21 years. He's an outside the box general dentist. He has a successful career in treating patients of all ages and disabilities. And I want you to hone in on that word disabilities in a non-conventional way using desensitization, because to work on people with disabilities is very, very tough. And this guy has made a career out of it. He's a fellow in the Academy of Dentistry International, clinical director for Special Olympics, Special Smiles, clinical assistant professor at UTSD Houston, co-founder of the Dental Desensitization System. He's married to his wife, Jennifer, father to his daughter, Jaden, and son, Ethan. But I'm going to just read this part because this right here really touched me. And I think it sums up who Jacob is. It says, I'm just a dad of an adult son with autism who happens to be a dentist, and those two worlds have joined themselves into what my passion and purpose is now. That to me is so badass, dude. You don't know how much that hit me. Like, I was getting teary-eyed reading that, because all of us here are parents, and all of us have our own issues with our kids, and I've got a son with OCD, and I've got a daughter with IBD. And when you said that, man, I just, that hit home. I'm a dad, JB's a mother, you're a dad. That's why you do what you do. That's your why. And that's awesome. So welcome.
Thank y'all very much. I appreciate y'all having me on tonight. Yeah. Okay. So let's get to the voting. I think the first thing that it's just fair to say is that JB had more to say. You had one item, but you did it very well. I'm going to say, you came with the information.
Yeah.
JB's going to get it probably because JB does the news every week.
True.
So, but
it's a honed skill.
Don't quit it. It's working.
Hey.
So if you're never out, you're going to be a good replacement.
She's an incumbent and I'm a challenger, man.
That's it.
Yeah. He's just going to keep trying each week, and you're going to let it put it out there. We're going to let you grow in your skills.
Yeah. So thank you for remembering the first question. JB didn't even have to ask it, but
yeah.
One thing
he already won the guest game, like guest with a T game, because you remember the first question.
I was so excited about, who you said you were, but I didn't even mention that you're from Breaux Bridge, Louisiana. So tell us a little bit about Breaux Bridge.
Yeah. So Breaux Bridge, if you don't know anything about Louisiana, it is the crawfish capital of the world. So if you're a fan of the little mud bugs, this is the place to go. You can probably throw a rock and hit 3 crawfish ponds from my house right now. So with the latest little spell of rain we've had, the crawfish mounds are already popping up in the yard.
Mm-hmm.
So do you, are you a fan of the crawfish?
Oh, absolutely. I mean, you can't be a Louisiana boy and not eat crawfish. That's so, unconstitutional there.
Mm-hmm.
Correct me if I'm wrong here, but Breaux Bridge, if you've ever traveled from Houston to Florida on I-10, is the last stop before the bridge from hell. Is that correct?
Yes. So Lafayette, Breaux Bridge, and then you hit the Atchafalaya, the 19-mile, basically purgatory of 2-lane highway. But on the right season, you can count the alligators, while you're driving. So it is at least scenic.
So 8 years old, we're driving to visit my grandparents in Louisiana, and I think that bridge is like 18 or 22 miles, whatever it is.
It's
At the
19.
exact halfway point, we had a blowout, and that shoulder is not very big. And my 16-year-old brother had to change the tire. And my mom, I remember getting off that bridge, and she said, "I'll drive the rest of the way." And God will probably go to hell for this, but my mom stopped and bought him a 6-pack of beer and told him just to enjoy it in the passenger seat because he was so nervous after changing that tire. But yeah, that was a long time ago. It was crazy. So tell us a little bit about your practice and what kind of moves you.
Kind of where it started. So as you said earlier, I've been doing this for 21 years. I had no intention of being a special needs dentist. That's not what I got trained in. At dental school, I had honestly no experience. I didn't even get the opportunity to treat anybody with special needs. It's kind of like going through your pedo rotation, and all the bad kids that they put behind the frosted glass that were screaming and needed to be papoose, you didn't get to see, and you were thankful for it. It kind of got to that point where I always thought if someone with special needs, it either went to pedo or GPR, hospital or sedated at a pediatric office. So I really had no experience in the world of special needs. And then, a year after I graduated, my son was born, and it was kind of the perfect storm. I had just opened my private practice in Creole, Louisiana. And so I was a year and 4 months into that. And Hurricane Rita came and decided to remove it from the slab. When Ethan was born, he had some complications at birth that, we thought was going to be a pretty basic little issue. Come to find out, he actually formed a blood clot from the umbilical catheter they had him in NICU, which stuck in his right renal artery and caused him to go into kidney failure and secondary congestive heart failure. So at 6 weeks, we're taking air vacs from Lake Charles to New Orleans, kind of struggling for life there. And everything was good. We got through that. So now I'm like, I've got no practice. I've got a child that's, struggling. And then 14 months old, we got our inoculations. And the very next day he got Bell's palsy. And after that, he lost all of his language. He lost all of his socialization skills. And we ended up moving to Houston after the storm because obviously I could not rebuild just due to lack of funding, thanks to the insurances. And when it push came to shove, we got a diagnosis at age 3. And from that point on, it's kind of been an everyday residency for me. Like I said, I'm blessed to have a child that's on the spectrum. I wouldn't change it. He's taught me more about what things are important and what kind of dad I need to be. But it also helped me be a better dentist, to be fair, because I was always like, man, I'm going to be a restorative guy. Crown and bridge fillings. Just do the stuff that we got trained for. And as he grew up, people saw how well he was doing with dentistry, and unfortunately, for a lot of patients that have a physical or intellectual disability, going to the dentist can be overwhelming. And what I had to figure out was how to do things that I knew how to do in a way that adapted to the way Ethan could tolerate it. And so, we're all trained in such a way that, like, we all know how to cut a crown, but what happens if the person that we're trying to work on won't sit still, won't open their mouth, won't, is combative? We don't have that training. And for many of us as general dentists, there is no way to, hell, you can't even get access to a hospital. And so I had to figure out how to still treat my son and the patients that were starting to come because of him, uh,
Mhm.
and the other families that we knew. It's amazing. Social media, once people, get that word out, then it's like I don't even have to market what I do because mama social media groups do it for me. But, it turned out to where if I did not have access to a hospital or sedation, and honestly, my biggest referral is pediatric dentist because many pediatric dentists who have these large open bays don't want to deal with one child with sensory issues who's going to disrupt the whole bay. So, we went through ABA therapy, which is applied behavioral analysis, and we did some intense therapies with Ethan when he was growing up from age 3 to age 6, pretty much full time. And then as we started kind of getting into school, we just did therapy alternating with that. So, my wife and I learned to listen to the therapist and how they taught him how to break down certain tasks into, smaller pieces so he can master each individual step. Well, I got to thinking, why can't I do that with dentistry? And so I started back in 2016 when I modified my office in Houston to be sensory integrated. And what that meant was I took what my office looked like, which, to be fair, dentists aren't the most, um, uh, I guess, well versed at interior decorating. We all have chairs and walls that are shades of beige. So it's not really sensory friendly. The sounds, the sights, and so what I did was I was like, well, what would Ethan like? And I thought to myself, well, he likes his sensory room upstairs at our house. So what I did was I just replicated my waiting room to be what his sensory room was. And then we adapted our treatment rooms to be more sensory integrated by just being able to adjust those sensory items that we all have. The lights, the music, any kind of sensory overload can basically cause you to, just shut it down immediately, and your appointment's over. So I got to that point with Ethan, and like, he did great. He does great at the dentist. Um, I mean, he should. Dad's the dentist, so I'd feel bad if he wasn't. But then I actually met Dr. Steve Perlman. I don't know if y'all are familiar with that name. He was actually the founder of the Special Olympics Healthy Athletes Special Smiles program.
Oh yeah.
Yeah.
Hmm.
He's actually a pediatric dentist from Boston, but he was the dentist who treated President Kennedy's sister Rosemary. And that's how the Special Olympics.
Interesting.
Start.
Yeah.
And so I met him in 2016, and he and I and a behavioral therapist from California actually toured the country for 3 years, and we lectured and together, and kind of spread the word about special needs dentistry from our different aspects. And he's been a mentor of mine, kind of from the beginning on just how to expand that program. But so I started with the desensitization as just the way that I kind of went outside the normal box and learned how to adapt my environment to fit those patients that were coming to see me. So I actually, from that, I invented a take-home kit for families, basically a dental take-home kit. And what we're looking at is how can we be more effective and efficient with brushing at home, so our prevention is better. So we're not just constantly seeing these patients once a year, throwing them in a hospital, trying to fix it all, and then a year from now we're right back where we were. So it's a combination of desensitizing the patient, but also educating the parent or caregiver to be able to do a better job of, helping them at home with their oral care. So in a nutshell, that's pretty much it.
Can you talk about that kit a little bit? Like, what does that look like for them? If that's a kit they take home, right? That
Yes.
the
Yes.
caregiver uses.
So there's 10 items in the kit. And I'll tell you kind of how the kit got started is, I was thinking all of the sensory issues, and most people don't know, there's 8 sensory, 8 senses. So there's 8 different ways to, basically piss somebody off at the dental office. And I hate to tell it, but dentists violate every one of those 8 sensory issues. And so what I did was I went through a basic exam and I thought, what are the items that we use in the office that are going to cause a meltdown or a sensory overload? So in the kit, I have a patient bib. And people go like, why do you have a patient bib? Well, like Ethan has a sensory issue to tags in his shirt. Well, if you go and sit in a dental chair and someone puts a big ass tag on you, that's going to cause a problem. I have a small suction just so we can practice like putting that in the mouth and putting our lips around it. Because sometimes just the sound of that causes problems, but the actual physical suction of it. And then modifying that, if you take that small suction and bend it at an L, it can replicate your pano stick, your bite stick on your pano, so they can practice at home how to sit still for a pano. Because x-rays are probably the hardest thing that we have to get. And it takes a lot of time. There's also a 3-sided manual toothbrush in there. Again, the rule came from one of our occupational therapists. And if you watch, if you ever have a special needs patient walk in, look at their shoes. And she told us if someone cannot tie their own shoes, they do not have the dexterity to take a manual regular toothbrush and roll it to get their gum lines. They can hacksaw real well. They just can't roll that toothbrush. So something more efficient like a 3-sided toothbrush allows us to get those areas that we're missing the most. So there's that. There is a metal tongue scraper. And I tell people it's not for your tongue. It's for the desensitization for the feeling of a metal instrument scraping your teeth. Which, I didn't want to put in a scaler or a explorer because someone's going to turn and you're going to harpoon them. And so I didn't want that for the caregiver. There's a mouth mirror and, every basic item that you think of, prophy paste. Okay. Why would you put prophy paste? Because of the texture, the extra grit. So we actually put plain prophy paste so they can mix it with the patient's toothpaste at home so they get used to the grit factor inside of it. So there's, like I said, it's very basic. But when you do it, when you go through the whole process, you can look at this and go, wow, I actually have now completed a basic dental exam and prophy. And we put the other thing, we put a stick flosser in there, a little Listerine stick flosser.
So is that something that you envision as word gets out about the kit that they like? I call the doctor's office. I'm going to make a new patient appointment for, my kid or whoever I'm in charge of and they have those particular issues and the doctor's office can supply that to them, or is the consumer buying that direct from your company or a company to start working on those things before they show up?
Yeah, either or.
Okay.
We can sell it to dental offices. We can sell it to, online. Here's the part that I wanted for my colleagues, because you may not be comfortable seeing someone with special needs. Okay. And that's what I hear the most. If you look at all the research articles and everything, we're almost 45% rejection rate. Someone with an IDD calls an office and they say, hey, I've got a special needs adult patient. I'm sorry, we're not equipped to see them. but yet we're not supposed to, by law, we're not supposed to,
Right.
dismiss a patient without even seeing them,
Right.
But then the other struggle that we face is, what if I cannot do anything? I don't know where to refer to. A lot of people just send them
Sure.
back to dental schools. Or you go, hey, look, I don't want to get in the middle of something and it goes south. And, like I said, I'm 6'4", 250 on a good day. And, I've been punched, kicked, bit, peed on,
Yeah.
I mean, you name it, and it ain't glory. But like some of the ladies in our profession, you don't want to come up against a guy that's my size that has the intellectual ability of a 2-year-old and
Yeah.
is aggressive, So that's scary for a lot of people. So why I invented the kit is because a lot of people, I use the acronym TIM, time, ignorance, and money. It takes too long. We don't get paid, for the extra time or for visits or fun visits. I hear that a lot. Like, we just had a fun visit, so they come walk through our office. I'm like, if you own your own private practice, fun visits aren't going to pay your bills. But what I do know is ABA therapist, occupational therapist, physical therapist, even parents and caregivers, they get paid to work with them every day. We don't. So why not teach the people that actually see them every day how to do it to your standard? So when they come in to your office, it ain't the first time that they've seen it, which makes it more predictable, the outcome of what your appointment is going to be. So, you can. The second side of that is the kit is great for the practice and the desensitization. But there's a second part is, we all have health histories that we send out to our patients. The problem with our health histories for our patients that have disabilities is it doesn't ask the questions that we need to know. Like, what are your issues with sensory? Do you have certain textures, certain tastes? Some of my kids come in and like, hey, look, I'll brush my teeth, but I got to have my SpongeBob spin brush.
That's right.
Great. Well, then make sure the parent brings it from home. Make sure they bring their own toothpaste. I don't know about y'all, but I can't fund every brand of toothpaste and flavor in my office. So you have them bring those things in. One thing that's another one is the vestibular hyposensitivity. So vestibular is basically where your head is in space and movement. So if you ever have a patient and you're starting to lean them back in the chair and they freak out and they jump, they're hypersensitive to vestibular. And for a lot of patients that have that, you have to lay the chair back first and let them crawl into it versus start to lean them back. If you don't know that, that will cause a meltdown, and you're done. So it's little things to that nature, that we try to teach, we try to explain. But to be fair, our career is one of those that we are all perfectionists in our own right. And what you were saying earlier, which, I was thinking about it, is like, man, what do you do when you got that one patient on your schedule and you just dread it? For a lot of people, that's their patient that has a disability, because you're out of your comfort zone as a provider.
Yep.
And while it may not be the person that complains or, the Karens of the world that are like, hey, this isn't the perfect match or the color or whatever. I tell people, I don't like treating neurotypical people anymore. Like, I'll take special needs all day long. But you get to that stage where a lot of people, it is just the ignorance that we have because we weren't taught that in school. It's kind of like if someone didn't teach us how to pull a tooth and the first patient that walked in was an extraction, you'd be like, okay, yeah, I have no idea what I'm doing. And your anxiety level goes up. So we're just trying to basically debunk a lot of the problems that people think they're going to have, which makes them not want to even have these people come into their office. So studies show over 85% of all patients with a disability can be seen without any form of sedation, stabilization, or hospitalization. So but we think it's much, much more than
right.
that. Yeah.
I think you give a lot of credit to your training after dental school, but what you don't give credit to is that a lot of what you do and a lot of even attempting to treat these patients, for those of us that don't really know exactly what we're doing and don't have the training that you have beyond, or the training that you've created, you don't give credit to the type of person that you are for actually seeking these abilities, because there's a lot of people that don't give a shit. I'm sorry, man.
Yeah.
There's a lot of people in our profession that that there's a lot of really good people that want to cater to every single type of patient they have, and they want to be the best at that. And that's hard to do.
Yeah.
There's a lot of
Yeah.
people that don't give a shit. They just want to go in and drill, fill, bill. Sorry,
Yeah.
folks. It is what it is.
Yep.
So you need
Yeah.
to give a credit to the type of person that you are. But I want to ask you a question. Are you familiar with the company Armor Dental?
No.
Sheree Lipinski?
No. Where are
All
they
right,
at?
I'm going to make an introduction this week because I'm gonna give a little shout out to Cherie. Cherie has created these products, and she was trying to figure out where they fit into dentistry. And she would agree with me if she heard me say that. But she's got several different products. They're bendable. They're kind of retractors. There's some that they use for lasering and stuff like that. But she figured
Okay.
out that she had a niche for special needs patients. And
Okay.
so I want to introduce you to Cherie. She's created this product that helps the caregivers and the special needs patients to retract their cheek. I mean, we can use them for scanning, we can use them for
Yeah.
lasering, we can use them for retraction, whatever. But this one retractor she created was the sole intent of special needs patients. And
Yeah.
you send them home with the patient, and the caregiver or the patient can actually retract their cheek and
Yep.
share with the patient, or they can, help them. So I'm going to make that introduction this week because I think you and her would hit it off. She's an amazing woman. She's created some amazing products that we use in our practice on a daily basis. But I think there's a lot of need for what you do, that this may be the 11th item
Yeah.
in your little care package that you might be like, oh, damn, I need this, because
Yeah.
I do see a need for it.
Yeah. We actually, it's funny you said that because, what I tell the dentists that are coming to my classes is there's two things that we fight: the ninja and the clam. And if you can only manage one body part at a time as a dentist, and so you have to figure out how to keep the ninja from the hands coming up to the face. But how do you open a mouth that won't open? And
Mhm.
unfortunately, there's a lot of wonderful bite blocks out there.
It's an
But if
oyster
you,
knife, man.
what's that?
It's
It's
an
an
oyster
oyster.
knife. Yeah.
If
Sorry.
if they have an issue with not wanting to open, I asked this. I said, well, how do you get somebody open that won't open that? And I've heard everything from put your finger in their mouth and push on the side of their upper molar, to put an instrument to the back of their mouth, to pinch their nose. They got to breathe eventually. So I mean, that was actually at the pediatric conference. That was hilarious. I was
Nice.
like, so I don't
Nice.
promote suffocation as a way to open the mouth.
No
But
wonder we have so many traumatized adult
right.
patients in our population.
But there's a part where for the parent or caregiver, even if you give them a traditional bite block, it's a rectangle. You got to get that thing opened up to get it even in there. And then good luck managing a head that's shaking,
Right.
and your fingers are going to get stuck in there and get bit. Now there's some that, it's an external handle. There's some that, you can hold with a stick. So inside my kit, I actually invented, I call it the DDS bite block. But I actually got the thought from two separate things. One, I needed something flat edged that I could use as a cheek or lip retractor, but also to pry the teeth that are together open like a flat edge screwdriver. So it's just a rubber based, like our bite blocks. The other side, which nobody else has done this, but I made the bite block round instead of rectangle. Because when you get a patient and they're just, chewing on the bite block, they can't spit it out. They can't get off of it. And I got that because right next door is a cowboy. And I was like, hey, a horse bridle is round. And if that moves a 2,000-pound animal, it can move a person too.
That's a great idea.
So I made it round so you can still hold it outside the mouth, obviously, but the patient can't get off of it, regardless of if they shake or if they chew on it. So yes, there's a lot of different items out there. There's a lot of wonderful products. In fact, I just did a class in New Orleans, and it was equipping yourself to treat patients with special needs. And it was basically just all the different things out there that are outside the traditional dentistry. There's products now that they can things that you can give the parent or caregiver at home, like Povi One, Povi iodine, super helpful. There's a company that's up in Minnesota that I've met, and they actually have these dissolvable mints or water supplements that actually change the biome of the bacteria in our mouths to eat the peptides of your saliva versus the sugars in your food. So it won't even form the acid that causes cavities. And it's all natural. It's all grass, and awesome. So it's like, how do I get someone who's non-compliant to brush at home to be able to do this? And it's not just special needs. It's your family members, that your elderly that have Alzheimer's, dementia, that are now becoming combative, that and I'm sorry, but our healthcare system with nursing homes that say, hey, if they refuse 3 times, we can't do anything to do it.
That's right.
And I'm like, that's BS. Like, their health is directly correlated to their mouth, and we're not going to do anything about it because they said no. I was like, I don't know. Like I said, maybe that's another topic for another day, but it is one of those things that I think for our profession, we've got to get over our own fears of treating this population by just, like I said, is it going to be perfect? Hell no. I tell you what, I do more crappy cleanings. I've done cleanings through the car window in the parking lot because a patient won't get out of the car. And I'm telling you, it ain't great, but it's better than anything. I still have patients now that will drive from Houston, Texas to Louisiana 3 hours one way just because nobody else is willing to see their adult, child without putting them in a hospital. And I'm like, great. Now, you can't tell me you ain't passing a few offices between.
That's right. Only about 1 million.
You're right. So I'm hoping, every time that I go and I do a class, and I'm real excited about, going out to the Aspire meeting in Tulum next year in January for AIDA, because this gives us an opportunity to really kind of speak to a different, audience, because a lot of the private practice dentists, especially the single private practice dentists that don't have multiple partners in it, they struggle the most because it's like, how many of these patients can I see? Because that takes away time for my other patients, and I can see more of my other patients than this one. So, it's cost benefit. And I tell people, in my offices, I've got other associates. And so they see all of the neurotypical family members. I just see the special needs, family members. And to be fair, like I said, God blessed me with a child, on the spectrum. And, I've been given that opportunity. And I just felt like at this stage in my career, it's, I'm up to the part of educating others, because, my call to action at the end of all my meetings is there will be a day that I'm not here. And, I hope that somebody that took one of my classes, was inspired enough to be able to open their doors when I can't be Ethan's dentist anymore, and they'll take over his care when I'm not here, and that shook me a little bit, because the day I turned 40, the year I turned 40, I should say, I got diagnosed with stage 3 lymphoma. And so I spent a tour of duty over at MD Anderson in Houston for 6 months, kind of figuring out if I was going to be on this side of the dirt or not. And it put a lot of perspective back into the world for me. And one of them was, we only get one tour of duty on this earth, and everybody's going to forget how pretty your crown was, or what your filling anatomy looked like, but they will remember who you helped and what kind of legacy you left behind.
Yep.
So, as we close, I want to ask a couple of things. One, how old is Ethan and what's he doing now?
Ethan is 20.
Uh-huh.
And it is 8:30, so his butt better be winding down and getting in bed here pretty soon.
Yeah, good. And what about Jaden? How old is Jaden?
Jaden is in her junior year as a psychology major at UL.
Oh man, you ever go to the corner grocery store?
Of course.
That is the best po' boy in the world, is it not?
Well, I tell you, the Borden's ice cream shop right by campus is pretty damn good too.
All right, dude. Well, we might have to meet up next time I'm in Louisiana.
Well, y'all come stay in the train, and y'all more than welcome to.
Well, you got to tell us a little bit about that.
Tell us about the train before we close.
Okay, all right. So, and can people see? Is this like they're watching?
Yeah.
Okay, so my wife Jennifer, she wanted a guest house, and so we were looking around at specific fun ideas. And we found an abandoned train caboose car just laid up in the woods in rural Louisiana. So called the mayor up, bought the car, built a 40-foot railroad track in my front yard, and we moved the train, and we gutted it, and then we built a train station on the back, and we made it a Harry Potter themed Airbnb. So
cool.
I'm currently, I bought a London double-decker bus, and I'm about to make that into the night bus. And so I tell people, dentistry just pays my Home Depot bills. That's all it does. I'm at that age right now where I just like to piddle on when I'm not in the chair. So this is my happy place. But yes, you want to come eat some crawfish and go eat some good food in Louisiana, you can come stay in the train.
Dude, we're going to hang out, man. You a Saints fan?
Absolutely.
Attaboy. There you go. I knew you'd say that. So, hey, do me a favor. Turn the screen just a little bit, like that way.
Towards the
other way. All right.
Am I good?
Oh shit. Back up just a little bit. All right. So there's something that I've been watching as we close the show, because we're coming to an end here that you guys don't really see. But if you look, this man's got a bald head, but right above his head, he's got a shadow. And to me, it looks like a halo. And I've been thinking that the whole time I've been watching it, because as I read his introduction and I was coming up with a couple of things here, I wanted to throw out a couple of definitions. The first one is adapt, and that means to modify. The second one is dad, and that's kind of a term of endearment for a man or a boy who is admired by his children. And the third is a father. It's a provider. It's a protector. It's a teacher. And the fourth is a dentist. And this gentleman has figured out how to merge all of those together to be admired, to be a father, to be a protector, to be a teacher, and really just take a lot of stuff that people take for granted and mold it all into one. I'm fascinated by you, man. I mean, and trust me, I'm not hitting on you or anything, but I am fascinated by what you do. I admire what you do, because it really takes a special person. But if we can learn from what Jacob does, I think we can do a lot for the world and for dentistry. And what you've done for dentistry is amazing. This desensitization program is absolutely amazing. I can't wait to meet you and shake your hand. I admire you already. I also just need to back up a little bit and give a shout out to AIDA for sponsoring this show, and tell them that anybody out there that if you want to go to Aspire, please do. You're missing out if you don't. It's a fantastic event. Jacob hasn't been there yet, but I'm going to tell him it's a fantastic event. Hell, I went last year as a speaker, and I'm bringing my whole team this year. We have a deal for everybody. I'm going to show it one more time. If you want to go, $499 for AIDA members. Just use the code DINKS. That deal has come and gone, but we still have it. Please go. The resort's going to be amazing. The teaching is going to be amazing. The fellowship's going to be amazing, but I encourage everybody to go. Jacob, thank you so much for being here, man. I mean, just
Appreciate
what a
it.
great story. I mean, not just because you're a Louisiana boy and a Saints fan, but dude, you're a cool guy, man. I love what you're doing for dentistry.
Thank you.
You taught me a lot tonight, and we do see some special needs patients, but and by the way, the person I wasn't talking about wasn't special needs, but we do
They never are.
we do see special needs patients, but man, I don't have the skills that you do. So thank you for being here.
Same.
Thanks everybody,
Thank you for having
and let's keep in touch. Okay,
Will do. Y'all have a great night.
Have a good night.
great night. Good night, everybody.